How is bladder outlet obstruction diagnosed? Imagine trying to water a plant, but the hose is blocked. That's similar to what happens in bladder outlet obstruction. To find out if someone has this condition, doctors use a mix of tests and examinations. First, they start with a detailed medical history and physical exam. They ask about symptoms like difficulty urinating, feeling like the bladder isn't emptying fully, or needing to go often. These clues help point toward BOO. Next, imaging tests are used. An ultrasound is a common non-invasive test that uses sound waves to look at the bladder and urethra. It can show if the bladder is enlarged or if there are signs of blockage, like a dilated urethra. Sometimes, doctors perform a cystoscopy, which involves inserting a thin tube with a camera into the urethra to directly see inside the bladder and urethra for narrowing or obstructions. They may also do a retrograde urethrogram, where dye is injected into the urethra and X-rays are taken to visualize any blockages. The most definitive tests are urodynamic studies, which measure how well the bladder and urethra are working. These include pressure flow studies that assess how much pressure the bladder generates when trying to empty and how much urine flows out. Video urodynamics combine these pressure measurements with real-time imaging, giving a detailed picture of the function and structure during urination. Recent advances include ultrasound techniques that analyze changes during urination without needing invasive procedures. Additional tests like urinalysis can check for infections, and blood tests help assess kidney health. Uroflowmetry measures how fast urine flows, providing clues about possible obstruction. Recognizing BOO early is vital because if left untreated, it can cause damage to the bladder and kidneys and increase the risk of urinary infections. Always consult a healthcare professional for proper diagnosis and personalized treatment options.